A barium enema is a type of conventional fluoroscopic procedure that is considered for dynamic action of the human body. Real-time images created to show continuous internal activities or functions of anatomical structures. This procedure could be considered both diagnostic and therapeutic depending on reported symptoms, health conditions, and health assessments conducted by the ordering physician. Radiographic and fluoroscopic unit is used. There are two types of technological systems, an image intensifier and flat panel detector. Flat panel detectors are newer units. They use fewer energy conversions, lower exposure settings, ultimately resulting in reduced patient dose. In short, barium, otherwise known as barium sulfate, is a viscous liquid contrast material that comes in a pouch-like IV bag. It may be diluted with water to control flow rate and other reasoning factors. For example, someone who is believed to have a perforation may require a water-soluble contrast. It is administered by a radiographer. The radiographer will insert a catheter into the colon as the patient lays on the table of the fluoroscopic unit, assisting and directing the patient to position them to take several cross-sectional images of the patient's large intestine, usually ordered to identify any physical abnormalities or malignancies that disrupt the patient's normal functions. The barium sulfate works by creating a thick coating layer lining the inside of the lumen, or linear series of sacs pouches called haustra, in the large intestine. The contrast is radiopaque. It absorbs X-rays, appearing white in images. The contrast is not radioactive. It cannot be absorbed by the body and is safe. The exam takes 30 to 60 minutes. ALAR is crucial. Usually there are 7 or more images, meaning extended repeated exposure. It is important to wear protective shielding to reduce occupational dose. So standing back, using barriers like lead curtains, portable lead wall, or the Bucky slot cover. At the end, the patient will then be asked to defecate in private to ensure all of the contrast material is expelled, and a final image will be produced before the patient leaves to ensure that there is no remnants of the contrast material. In the event of a double contrast enema, air will be administered to identify the perforations after barium is drained by a catheter. Please be aware that there is preparation consisting of a diet prior to the procedure to ensure that the patient's bowels are completely empty and that there are no interactions or interference with the fluoroscopic imaging processing.